We talk about people in strange ways. We talk about treatment-resistant clients. I was treatment-resistant. And what treatment-resistant really means, is what we are doing ain't working. But we blame the client because we can't possibly take responsibility. Psychiatry can't say it's our fault, you're not getting better. So we blame the client. I also did a strange thing. I had schizophrenia and I recovered. People can't handle that. You know, we work in a health profession where when you recover from schizophrenia, people start saying strange things about you. They say things like, well, he wasn't a normal schizophrenic. Or even worse, he never really had schizophrenia. Like I took a 10-year holiday in acute psychiatry. Yeah. Yeah, I may have been mad, but I was never, ever, ever stupid. And I look at my journey, and the Hearing Voices Network was a really important part of my journey. And people always associate that somehow I went to this group meeting because of sort of some purist reason, and it was self-help and all this kind of, and that's all bull. I went to this meeting because I had a support worker. You know what they are? Anybody do support work or done support work? I hate yous. I really do, be a passion. And Lindsay Cook was my support worker. And she came into my life when I was in hospital, and she was a really strange woman, like most support workers, you know. She had long red hair, and they were in dreadlocks, you know. You can imagine, you know. And she didn't walk anywhere. She bounced. You know, one of those people, you know, they're always bouncing, you know. And she was always smiling. You know, first thing in the morning, she fucking smile at you, you know. And she said to me the first time she met me, she said, "My name's Lindsay and I'm your new support worker. And I'm going to spend an hour with you." And I looked at her and I thought, fresh meat. Bring it on, you know. And after 20 minutes of this first meeting, I thought, I need to get rid of this woman. You know, she's doing my head in. And what's great about being a voice hearing schizophrenic is it's dead easy to get rid of people, right? What you do is you go up to the nursing station and you say to the nurse, "That woman's making my voices worse." And the nurse comes and says, "I think you should leave, Miss Cook." You know, it's great. Yeah. And she stopped coming to see me for an hour. She was quite clever, actually. In fact, she was a stubborn git. You know, she really was stubborn. And I've decided the number one quality in a support worker is stubbornness. Right? You got to be stubborn, because we're stubborn. When we're in the system, we're stubborn. We are trained to be stubborn, right? And she would come in, and she started coming in for 5 minutes here and 10 minutes there and another 5 minutes there. Just as, and she would always say, "I was just passing," you know. And she used to come in every Thursday evening on her way home from work. And she'd pop in, she always brought me 10 cigarettes. Right, this is days when you weren't seen as a leper if you stood out there and had a cigarette. It was actually okay. Right, and I used to always say to her, thanks very much, I'll give you the money back tomorrow. Aye. So I'm owe Lindsay about £3,500 or something, because she never ever got the money back. But one of the problems with being a schizophrenic is this sort of memory loss you get, you know. And then one day she came in and she said, Ron, there's a new group starting in Manchester, and it's called the Hearing Voices Network. And I said, aye. She said, do you want to go? And I said, well, what is it? And she says, well, the idea is we get these voice hearers together and you'll sit in a circle and you'll talk about your voices. And I said, don't be so bloody stupid. That's the most crazy idea I've ever heard, sitting there talking about voices. I don't hear voices anymore. Shut up. You know, and she said, no, you should go. And I said, no, I'm not going. And she went away. I told you she was stubborn. And she came back and said, look, I've talked to the doctor. And he said I can take you on my own to the Voices group. And I said, I'm not going. Because any time I left a ward, I used to have 2 nurses with me. And it was always these 2 big guys. You know, they were like sort of, I don't know if they could speak or anything, but they were big. And they used to walk on either side of you in touching distance. And they would take you to the shops. Can you imagine? You're walking down the road like that, you know. And everybody's going, he's from the hospital, you know. You can tell. And she said, and I'm getting to take you on your own. And I said, I'm not going. And she says, no, but look, Ron, when we go to the group, we can sit there. And I said, I'm not going, Lindsay, shut up. She says, no, I'll stay with you through the group. I said, I'm not going. And she says, and after the group's finished, I said, I'm not going. She said, we'll go to the pub and have a pint. You know that Paul on the road to Damascus moment? That was my conversion. Instantly. And I looked at Lindsay and I said, can we go now? You know. And she said, no, it's on Thursday. And Thursday came and I went to the group and I walked into the group. Nan Walton was there. And Mickey DeValda and Sharon DeValda. And Anne said to me, are you a voice hearer? And I said, aye. She said, they're real. And what a difference that made to my life. You see, I've been told that for years they weren't real. That's what we tell people. We know it must be distressing, but nobody else can hear them and you must learn to ignore them. What a load of rubbish. All I can say about that group of people is they've never heard voices. And that's why we end up learning to lie. We end up learning to say, they're not real, I don't hear them, they've gone. We're actually taught to lie. You know? Because when we say, they're still there, they come and give us more meds, or they come and do this, or they come and do that. And in this group, there's this woman saying, they're real. It's okay. You can acknowledge them. And you know what's great about voices being real? You see, when they're not real, I'm waiting on the system doing something. I'm waiting on the miracle cure. You know that cure they're telling us for schizophrenia that's always around the corner? You know that corner that's become so big it's now a circle, that corner. We're still waiting for that cure, you know, all the time. But when they're real, that means I can do something about it. That means I can take responsibility and ownership of my experience. That means my recovery belongs to me. As long as I find the right people to walk alongside me in that journey. And I was lucky. I had some of the best. I had Mickey DeValda, Sharon, John Williams, Terry McLaughlin. I had Marius Rom and Sandra Escher. I had some of the best in the world to walk alongside me in that journey. And I walked in that journey. And that journey changed my life. I could have been Mickey or John. I know that. Except I did something, unfortunately, they didn't do. I moved away. I got totally out of the system. Mickey couldn't because of the law. And John was far too loyal, I think, to the Manchester office and would never walk away. I was lucky I walked away and went to live in another part of the country and never got in touch with psychiatry. You know. And in that other part of the country, I healed.